there's actually quite a bit. The first thing is that psilocybin has been, so this is a hallucinogenic substance that is found in some mushrooms, has been under scrutiny by the cluster community since anecdotal evidence in the 90s just raised this interest. But now the scientific community is interested in this molecule because there is actually a scientific rationale on the mechanism of action on psilocybin on the serotonergic system. And on the other side, the legal issues are moving forward because there's more and more research done on this product, especially on post-traumatic stress disorders. And so it might be that the legal status will change and allow scientists to study psilocybin better. The first exploratory trial of psilocybin has been published by Dr. Schindler on a very small number of patients, but showing promising results even in chronic cluster patients. So we need bigger studies. There's been a lot of research a few years ago about sphenopalatine ganglion stimulation, and that was also very promising, including in chronic clusters. So the idea is to stick a little electrode that is going to the SPG zone, and it's kind of screwed in the upper gum. This is not a very complicated thing to do. It is feasible by an maxillofacial surgeon. Very unfortunately, there were issues with the actual company, so the product was never launched, and so it is somewhere in between now. We don't know if it will ever come back. Another interesting zone is a CGRP blockade. So there is an ongoing trial now with Eptinezumab or VEPT at a high dose of 400 milligram for cluster headache. And so I think that that's a question that is not yet resolved. Even if some trials for chronic cluster were negative, there is anecdotal and evidence and series suggesting there might be a benefit. So I think the jury is not out yet about CGRP blockade in cluster headache. Regarding TACs, the numbers are so small that it's very difficult to conduct RCTs. So I think teams are continuing to publish series and to test usually what works for cluster in other TACs. Though for SUNCT, actually there's a lot of interest in surgical approaches that mimic what we do with trigeminal neuralgia, and this appear promising for this particular type of TAC. So there might be some more options for SUNCT patients in the future.